I grew up in Florida and I'm actually currently living in Colorado. So I've been a nurse since 2012. I was a labor and delivery nurse for about 3 years. I went to University of Central Florida, and then I decided I wanted to pursue women's health further. So I went to Thomas Jefferson University in Philly and got my master's degree there, specifically in women's health nursing. And ever since then, I've been in the field of reproductive medicine or reproductive endocrinology, which is specific to women's fertility. So I have spent the last 5 years working in a reproductive office, doing things like inseminations, IVF cycles, oral cycles like Clomid, letrozole, things like that, really managing fertility cycles for patients.
Fantastic.
Yeah.
Wow.
Yeah. So I've kind of seen both sides of the women's health field. I started in labor and delivery, and now I'm back on the other side of helping women reach that goal. So it's pretty cool to kind of have seen the whole spectrum from start to finish. So I specialize in a lot of unexplained infertility, PCOS. A lot of the PCOS patients that I work with have a metabolic or nutritional component. So they're at risk for high blood pressure, metabolic disease like heart disease, things like that. So when you pair the hormonal irregularities of PCOS with the nutritional component, I really work on matching those two things up to make sure we're getting, as the longest strides we can towards reaching the goal. Yeah, so I really enjoy PCOS. I had a huge PCOS following back when I was working in Pennsylvania, of patients who really were able to utilize the nutritional component. But really the most important thing to me is being adaptable, being willing to implement some changes. I can give you all the advice in the world. I can guide you. I can tell you, hey, these hormones we need to pay attention to, or we need to draw this lab, or make these changes. But if you're not willing to adapt or change, it makes it much more difficult. Anytime I see a patient, no matter what culture it's from or what their struggle is, everybody has their own struggle, whether it's a weight struggle, a PCOS struggle, endometriosis, something like that. As long as you're flexible and adaptable and willing to try some new things to help, push you towards that goal, I'm all game. To all you girls out there trying, I believe in you. It will happen. We'll get you there. It's tough, but also reach out. A lot of people who are in this infertility struggle don't realize how many other people are also in it. So use your support system, whether that's us and whether we can help you, or talk to your friends, your family, talk to strangers and blogs, do what you need to support your mental health. I'll see you soon, guys. Bye.